So, good evening and welcome to our virtual program, Acting Out from Toddler to Teen. We are very grateful to have with us Dr. Brett Biller. Since receiving his doctoral degree from Pace University of New York, Dr. Biller has maintained employment at 3 of New Jersey's 4 legislatively designated regional diagnostic and treatment centers. As a licensed psychologist working with children and families who have been impacted by maltreatment, Dr. Biller has had the privilege to work clinically with children, adolescents, and families from diverse socioeconomic and ethnic backgrounds who have experienced varied maltreatment, including physical and sexual abuse, neglect, and exposure to domestic violence. Dr. Biller has conducted forensic evaluations as well as provided ongoing individual and group therapy. He additionally consults with and provides educational lectures to schools, children welfare agencies, law enforcement, and other medical and mental health professionals, as well as provide expert and fact testimonial in criminal and civil hearings. Dr. Biller was the founding director of training at the Dorothy B. Hirsch at St. Peter's University Hospital in New Brunswick, where he developed and directed a forensic doctoral training program. He currently serves as the mental health director, section chief at the Audrey Hepburn House at Hackensack University Medical Center in Hackensack, New Jersey. Dr. Biller has also served in leadership roles within several professional organizations, including the executive board president of the American Professional Society on the Abuse of Children, New Jersey chapter, the chair of the New Jersey Psychological Association Committee on Legislative Affairs, and as the member at large for the NJPA Executive Board. So at this time, I will turn it over to Dr. Biller.
All right. Thank you so much, Allison. Since this is going to be a discussion about parenting and raising children and so forth, I could acknowledge that it's obvious that my mom wrote that description of my experience, and she's very proud of it. But no, I joke because it's interesting. Is I've been fortunate to work with a really vulnerable population historically in folks who've experienced some sort of maltreatment in their family, but more recently we're moving into really getting at parenting responsibilities and where we strengthen parents, and it's really getting into my initial background where I have my master's is in science of education, where I worked in schools as well to help families. So it's a real pleasure to be working tonight in the area that's nice to talk about, although very difficult. I'm going to share my screen, and you will follow along with the slide presentation that I've put together. Just to let you know a little bit, as I've reviewed the questions that were submitted in advance, and they're all phenomenal questions. And as a parent, I could relate to too many of them. And if we were together, it could go back and forth about our experiences. I'm going to try to address the questions. A lot of them were similar. Some of them were specific to certain situations. So I'm keeping them in my mind when I am talking. Hopefully I'll address them in a broad brush, and then provide resources for each one of you, if you have questions, to really hone in on how to help out after, and where you could go to get some help after with specific questions, including if you need to reach me or contact me or someone else at our program that could be of assistance. Like Allison said, I am the mental health director at the Audrey Hepburn Children's House. We're up at Hackensack University Medical Center. We have a new program actually called the No Hit Zone that gets into parenting responsibilities and assisting parents in raising responsible adults. And we're going to talk a little bit about that towards the end of the presentation this evening. And we'll give you information on how, if you're interested, you could participate, and it's a free program. But that program is throughout the state of New Jersey. We do in-person groups, parenting groups, both here up in Hackensack as well as down at Jersey Shore, and virtual sessions online as well. So that's enough about me. So just so you know, also to give you an idea of the outline for what we're going to be talking about today is really going to start at a foundation of understanding in general the developmental trajectory of kids from infancy through adolescence, and that's going to serve as the foundation to talk a little bit about what we refer to as positive parenting, or in the groups for the no hit zone, we're calling positive and productive parenting. And we'll talk a little bit about how the understanding of developmental functioning really is key into understanding parenting, so that we're able to uh, differentiate between what's problematic, what's not problematic, and how we could address those two different issues. Because oftentimes when we're looking at parenting, we look at our child's actions, their responses, and we look at it from an adult perspective, and we look at it from our mind. And so I ask you, when we're going through some of the developmental stuff, it's going to seem basic, it's going to see pretty common sense, but what I want you to do is, if we can, suspend our adult way of thinking. So when we start talking about specific behaviors that children engage in, really to understand it from the developmental level that the child's at, so we could better understand how to respond to children. We're going to talk about this positive parenting, which is going to look at us understanding our children, but also us modeling to children so that they can demonstrate more of the behaviors that we're looking for, both directly and indirectly. And we're going to talk about some principles, specific techniques, some specific ideas on how to positively influence parenting, as well as specific concerns within parenting. And then we're going to talk a little bit about the No Hit Zone, which is a program that may be beneficial to some of you. And you may be interested, and we'll give you information on how to get more information on that if you're interested. And it's really about an ongoing parenting group. So that's going to be the outline, I guess, if you would. And then we'll take some questions at the end. Okay. So where are we going to get started? Obviously, we're going to get started in the infancy, and we'll move forward. It just makes sense. When I talk about what's typical behavior and atypical behavior in children, one of the I like to look at the macro, or the larger picture, and then the minor picture, because it's easier to conceptualize if we think of that when we move from infancy through adolescence. So the general picture for that first year of life, I want you to think of, when we go through some of this, a lot of this is internalized, exploring the world and bringing the world in. And that's going to be different from year 2, as the child starts exploring externally, versus in year 3, the general concept. Obviously, every child is different. There's going to be more of a reciprocal social relationship between the child and the caregiver. And that's where the child is going to explore the first year, second year, and obviously what they're learning in the third year. And then as we move into year 5, we start to see the social aspect of integrating all three of that, is relying on the caregiver, understanding a little bit about themselves, and looking at the social world in others, in other children, other caregivers, and so forth. In latency age, so that's in your, if you think about it, is the elementary school years, really understanding and coming to understanding themselves in the world around them and the rules that apply there. And then we get to an interesting part we'll talk about, is preteens and teens, where oftentimes in those preteens or teen years, some professionals refer to it as the second infancy, because that's a period, again, where hormones are roaring, and children really are finding themselves all over again in a different way than they had experienced, similar to when they're in their infancy. So that's the general focus, but let's break it into more of the smaller ideas. So if you think about it, is the children that you've cared for in year 1, we see that the communication is really, and some of these, if you look in the light blue where we talk about the social, emotional, and then the communication, physical and cognitive, those are different areas. Those are really at the end of obviously the first year. The typical behavior is going to describe more of the general. We understand that obviously crying is the main source of communicating concerns. We think about this, and if we're going to look at the theme of suspending our adult way of thinking, is oftentimes as new parents, and it's very difficult. And speaking for myself, I do have a 1-year-old who's is getting ready to eat and go to sleep now, but we misunderstand crying as something that's different than just communication. Sometimes, a child may cry because they're hungry, because they're tired, or because they're just upset, whatever it may be. So it's really understanding your child and the different cries. And we can't get into it this evening, but the research has shown that each child has a different cry for a different need that they want. And sometimes they'll have that low cry when they just say, hey, come get me out of the crib, I need attention, or that scared cry when they really need protection. And you get to learn that. But the other ways of communicating are through that cooing, that laughing, that smiling. But it's also building that attachment. And when we talk about attachment, it's that bond between the primary caregiver and the child. And there's different types of attachment based on how we respond to our children, and really mold how they respond to us moving forward. A lot of the objects, if you remember when your child was in that first year, is that internal, they're exploring it through their mouth. They're exploring it, by taking it in, and, everything they touch goes into the mouth. If we break down and we look socially, emotionally, they begin to play mutual games. That's I've tried to provide examples. Peekaboo, high five. It's always fun when your child starts to respond in that way. There's the communications where they start to wave. And it's funny because I'll use my daughter as an example. I have a daughter who just turned 1 last week, actually. And it's funny because my wife and I talk about how we feel bad, when we start saying, people come over, her grandparents or whoever, and we're like, oh, look, she learned something new. It's kind of like her new trick for the day, but it's exciting when you start to see your child, start to participate in those new tricks. But it's also could be very anxiety provoking, and we have to give a place for that. And what I'm talking about, we're going to talk about a little bit in the positive parenting. We have to give a place for our emotions and deal with our emotions as we parent, because that's a foundational part of not only our response to our children, but our children's response to us. So we see physically, they start to get stronger through the year. They pull to a stand, or they're cruising, which is when the child is obviously holding on to, a couch, something else, and they're able to, stand up and move around. That's cruising. Using the pincer grip. So that's really with, their forefingers and their thumb, or sometimes it's the middle finger, forefinger, and the thumb. And so you'll start to see where they go from picking up with their hands to that pincer grip, and then drinking rather than from whether it's breastfeeding a bottle or something else, they move to a cup. And even with a straw, that's still considered a cup. And then obviously cognitively, we look at things. They look for things that are hidden. They're able to take something and put it in a container, or take it out of a container. As an example of something that's important to understand for developmentally, when we say looking for things that you hide, it also is applicable to one of the things that parents have difficulty with is, you've had a long day, you're trying to feed your child dinner, they're sitting in a high chair at this age, and they start to throw food on the floor, and you look at it and you get frustrated, and the child smiles. And, from an adult perspective, we say, oh, they're being a pain in the rear end, they're testing me. But in reality, oftentimes they're exploring something called object permanence. And object permanence is the idea that something could go away and then come back. They're also exploring the idea of safety in the caregiver, that they're throwing something down and you're there to interact and assist them with something. So, I say that is understanding that it may not mitigate or may not solve that problem of them, but when we understand it, it may impact us less, so we can move forward in a different manner in addressing the concern. So it's not problematic, but it's healthy and it's exploratory. Obviously, some of these things, when we talk about the atypical behavior, we're going to talk about where it becomes excessive, where it's not responding at all to redirection. There are going to be times, no matter what, whether it's an infant, whether latency, whether it's an adolescent, where your child is not going to respond to you, and it may be for a whole bunch of different reasons. It's when we see the pervasive nature of that, and we see the ongoing nature of that, despite intervention, whether you or somebody else, that we have concern. Socially, we want to see them interacting with others, and when they don't, then we have a concern. And those are things that you could reach out to a pediatrician about, or even if they're in a preschool, if there's a professional that you trust there, to get a better sense of whether something needs to be assessed so that services could be provided. One of the things is, we're going to move on to year 2, but I also want to talk about, when we're talking about atypical behaviors and we talk about reaching out for assistance, it's difficult as parents. I want you to know that there is nothing wrong with reaching out for assistance. And when I say it's atypical, it doesn't mean there's a problem with your child. It's differences in our children. So that's a mindset we want to come at. There are a lot of times that there's atypical behavior, atypical development, that when provided care early on, so whether it's speech services, whether it's physical therapy, whatever it is, the child is easily able to catch up to their peers, and it's not an indication of a life sentence of struggles with social interactions, or learning in school or whatever. Sometimes there may be a bigger issue, but more often than not, early learning can help that out, and you need a little bit of a kickstart. And there's so many different reasons for that atypical behavior. So I want us to be mindful of that while we're talking about some of these issues. So obviously, typical behavior, 2-year-old, they're learning through exploration. So it's more external, rather than, when we think about exploring with infancies, they're putting objects in their mouth, they're holding it close to them. Now we're starting to see more of the externalizing stuff, which could be problematic. As you see on the slide, that example is making a mess and climbing on everything and getting into everything. It's a pain in the rear end, but it's normal. It's part of that exploration. So our responsibility is to keep them safe. One of the things that advice specifically is, if your child continues to engage in this activity that's exploring but dangerous, be careful not to continually repeat no, 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 because there's a difference between no and you not wanting to do something, and no that something is dangerous. So one of the techniques we talk about is, when a child is engaging in something that's dangerous, rather than saying no, we want to say danger. So they understand the difference between no, it's not something they could do right now, versus danger is something that they can't do ever. And you'll see a difference we want to get a difference in the response. But to move things along, socially, emotionally, we see reference caregivers' face, social cues. So important that we've all heard, when your child gets hurt or the child you're caring for is injured, that we're able to respond to them in a healthy manner, that we're not going to over dramatize it, even if we're scared and nervous ourselves. And that's a normal response, because they're going to take their cues off of us. And you'll start seeing, as they progress and they get older, we joke and say, oh, my daughter's like me, my son is like my wife, whatever it is. They start to pick up on, naturally, the organic aspect of who they are, but also they pick up on the environmental. So they're going to watch us for our reactions, the words we use, how we say them, how we eat, what we eat. So we have to really be important to remember that we're modeling. But we start to see in the year 2, they become more physically active, kicking, running, more stable in their walking. We start to see the walking is usually at a year and beyond. So some children are 9 months to a year. Some were at 12, 14. Progression. Where you're going to see concerning or atypical behavior is if we don't see that progression. If they're crawling and they're not trying to pull themselves up and do that cruising or holding on and walking. If we see socially in year 2 that they're not playing, at least alongside others, they're consistently just interacting with themselves, those are some of the concerns that we want to see. You'd be surprised at how much that even side by side or parallel play, one child playing in the same area as the other, really helps each other's development. So it's important to do that. So even if your child is not yet ready to play with another child, allow them to play in the same space, and you'll see how they start to mimic the advanced behavior of other children. So we move into year 3. And this is where I started talking about, they move towards expanding the social circle. So it went from internal to external, is interacting with the caregivers, to more of a social circle. We start to see their ability to calm themselves upon separation from their primary caregivers. What I did say is, what I didn't say is, you're going to start to see that stranger danger, stranger anxiety at 9 months. You'll see as they get older, they're able to manage the understanding that it's okay to be with others, and also that you'll leave and come back, and that's a healthy attachment, that they're able to do that. Communication, start to have at least 2 back and forths. Year 1, we start to see 1 word. Year 2, it is easy to remember. We start to see 2 words. And then in year 3, we start to see the communication back and forth. Children are able to understand some of the W questions more concrete. Who, where, and what are really the 3. When could be difficult depending on the child. Obviously, why is a really difficult question, and if not even possible at that age. And we start to see that more at 5. But physical, we start seeing the child being able to string things together, use instruments to assist themselves. They're able to draw. Again, with the atypical, not negative, they struggle to settle into new environments. They're not able to engage in activities with others. They don't respond to social cues, which are all going to impact the physical and the cognitive as well. We move into year 5, and that's an interesting time because for some children, this is the first time they're interacting with a school environment. So some kids have the opportunity to attend preschool or have play groups or whatever. But until year 5, some kids aren't learning about specific societal rules. Turn taking, repeating things, involving listening to stories. So we really see an expansion of an integration of all of what we saw in the exploration up until now. So years 1 through 4, we really start to see rule application here. We see guidelines, boundaries. Beforehand, we see more, it's more free flowing, their explorations and so forth. But it's really, it's the structure that we start to see children adapting to, which can be very difficult. If you think about it, we talk about a need for a relationship between free-flowing things, loving kindness, but it's also important as we become responsible adults that we understand the relationship between boundaries there. Oftentimes, that's when you start to see, and I know some of the questions are, what if my child isn't following the rules, or becomes aggressive with following rules, or becomes angry with me in following the rules? So the first thing for us is we want to take an understanding and say, that's normal. This is an appropriate part of that exploration. I only say that because that helps us emotionally, because oftentimes our children choose the least ideal time to demonstrate their acting out behaviors. So it's at the beginning of school, or it's at the end of school, or it's at, in a shopping center, or a supermarket. And so by reminding ourselves, okay, this is part of developmentally appropriate functioning, and where their child is at that moment, and that typically most of the people around you have experienced something similar. It helps with your own emotional response to this, because of whether it's embarrassment, shame, concern, fear that your child isn't doing something that they should be doing. How is it going to impact them? All of these are normal, and we have to give a place for those feelings, so then we could address appropriately the concerns of acting out. So one of the things in your modeling is an example of how to manage this is validate where the child's at. So I understand this rule is really difficult for you, and it's upsetting to me, or it makes me sad. when you're sad or having the choice. So you're acting out right now is, what do you feel? A lot of times we see anger is a really difficult thing. And I know that came up actually in several questions. Anger typically is when a child is not able to manage their feelings. And that could be for a whole bunch of reasons. One of the ways to help with that is really get into exploring different feelings with your child so that they understand the differences between different feelings and they're able to communicate differences about different feelings. So what's the difference between sad and mad? Oftentimes they come out as anger because a child isn't able to express the difference between it, or disappointment, or whatever it may be. We get that anger because a child, A, doesn't know how to express it, and B, they don't have coping strategies on how to deal with that particular emotion. So it's important that we explore that, particularly at this 5-year period. We're going to start to see at this 5-year period too, is a lot of times we're going to see those concerns that are associated with attention deficit hyperactivity disorder, or some more concerns about children with developmental delays. And the reason we start to see that more prominently is because of two reasons. One is because of the enhanced structure that we're putting into children's lives, as well as oftentimes now we're able to see a difference in different environments that children have. So home children react very differently than they do at school. There's many of you, I'm sure, that have heard from a teacher and they said, oh, he's wonderful, she's great, she responds to her peers, she listens to directions. And you're thinking to yourself, who is this child that they're talking about? Because mine doesn't listen to me at home. They don't follow the directions. They're mean to their, whatever it may be. But you'll start to see that difference in responding. And the best advice from that is see what the differences are in the different environments. And so if there are positive behaviors in school that we're not seeing at home, what are the aspects of school, whether it's structure, consistency, whatever it may be, that we could apply in the home setting, and vice versa. The more consistency you have in the positive functioning, the better off you're going to be. And working with the teacher in that will benefit you, the teacher, and your child. So let's continue to move on as we're talking about behaviors in the developmental or latency age. It is really broad. These latency age is a time of really great development in children in all areas of learning, in social emotional functioning, even in physical growth. And you see a lot of disparity between children. So this is really basic. It's funny because when I talk to parents and I talk about this idea of they have the propensity for logical thinking, doesn't mean that they have a logical thinking. As we get into adolescence too, one of the problems is that we see that we expect that children in their adolescence and their teenagers, that they use logical thinking. One of the things we recognize is the capacity or propensity for logical thinking does not mean that logical thinking is used. Ironically, there's a well-known psychologist, and if those of you who've taken general psych classes, you may have heard of Jean Piaget. And Dr. Piaget talks about the capacity for operational thought, and that is thinking logically, sequentially, looking at choice and different options. And the crazy part is what Dr. Piaget talks about, and this is something that's held for many years, is that even into adulthood, only about 60% of adults will appropriately use operational logical thought. So we all have the capacity to, but we don't use only 60%. So almost 50% of us are not using logical thought when we make our decisions, interactions over. So we come to an understanding that even in children's latency, and then as we start to talk about in adolescence, it's not surprising that they don't. And we'll talk a little bit about adolescence. Is what they know doesn't necessarily convert into what they do. Or how they act, which could be frustrating and dangerous at the same time. And we'll talk about some examples. So we see early latency. So that's more of first grade, second grade, third grade. We're going to see, there's an idea of there's a reluctancy um, for self-control. There may be some resistance to that. They're exploring where they're able to respond to added structure. In middle latency, we're going to start to see more stable ability for them to internally regulate. There's exploration of that delusionment with the previously idealized parent. So they're going to recognize we're not perfect, and that haunts us and is problematic in adolescence. We'll talk about that in a little bit. And then we're going to start to see true mutual understanding of peer groups, where they can understand the impact of their actions on their peers, where they could rely on their peers. They are more reliant on developmental friendships, and you start to see as you go through that latency period is they're really reliant on their peers for information as well as social cues. And we as caregivers become oftentimes the negative Nellies, the always say no's, don't understand them, all those horrible things that teenagers see us as caregivers to, because the peer group becomes a lot more important. That only escalates into the teenage years, where we start to see some of these typical behaviors. And I was talking about before that we see there's sometimes the adolescence is that second infancy, because they start to explore their independency in a whole different way, and it's in combination with the hormonal changes that are going on, and this what we see in infancy, the egocentrical thought. And I don't mean, when I say egocentric, I'm not talking about narcissism, even though it can be. It's that perspective of self, looking at self and the world and not understanding the larger impact of their actions. And that typically results in what you see in those negative atypical behaviors of executive functioning, problems with keeping friendships, needing help with self-care, whether it's putting using deodorant or brushing their hair. I mean, we see all the time kids now, if you watch kids walk to the bus, they're wearing pajamas or what looks like pajamas every day. And in some families that becomes a fight, and some we recognize this is part of their exploration. As long as they're safe, healthy, and appropriate, sometimes we give way to that. So this is the developmental understanding, the foundation that we really come to understanding, and is a key part in what we talk about positive parenting. Positive parenting is a movement in parenting that is more an ideological understanding as well as specific behaviors that are operationalized from the general concept. And when I talk about this positive parenting, it comes from a place of really enhancing families and public health. And what I talk about that is we're looking at parenting from a family level. So it's not just about the child, it's not just about the caregiver, it's about the caregiver and their abilities, it's the child and their abilities, the interactions there, and the support that could be provided from the public or the community. And when we talk about communities, I apologize, we're talking about extended caregivers, we're talking about school environments, we're talking about mental health folks, medical, pediatricians, all of those people in combination, as they say, it takes a village, are there to support caregiving for parents. And one of the biggest things that I always tell parents is, do not feel embarrassed to reach out for help. What you are experiencing is normal. What you are experiencing, other people have experienced. And if you deal with it on your own, you're more likely to cause emotional stress for yourself, emotional stress for your child, and difficulties along the way. So there are resources, and we'll talk about them in a little bit. These are the 5 core principles of positive parenting. Ensure a safe and engaging environment for your child. That's really important. So, we're going to engage in some parenting practices, and we'll talk about those. But the most important is we ensure safety. That includes, one of the things about positive parenting is not using physical discipline. I'm not talking about abuse. I'm just talking about spanking, because it has a negative impact on modeling emotional regulation. It reduces brain gray matter in the brain. It negatively impacts neural development. All research that is relatively new. And for those of you who want to know more about it, we could get into that. But more recently, in 2018, the American Academy of Pediatrics, who provides guidelines for pediatric care, has come out against physical discipline. Historically, they've recommended not using physical discipline. Now they've come out against physical discipline because of that concept of really wanting a safe environment and using parenting skills that were more engaging rather than causing a friction there and responding emotionally. We want to create a positive learning environment. So we're reinforcing those positive aspects, even when it's little. We want to create a positive environment where the child is able to explore their emotions. And then we want to use assertive and consistent discipline. That is one of the most difficult things that causes problems in parenting, is we need to be consistent. So when we want to set up rules, we want to make sure that it's either ourselves or our partners, that it's something that we can consistently abide by. Not going to be perfect every time. Nobody is. That's fine. The other difference between being assertive and authoritative is that there's a difference between authoritarian versus authoritative. And so we want to be authoritative where we're assertive and our child knows the expectations, but authoritarian is not. The authoritarian doesn't allow the child to have a place in the growth and so forth. We have to be realistic. And that's where we comes into understanding some developmentally appropriate versus inappropriate things. And then we have to take care of ourselves emotionally. That's one of the key things that I think is foundational to appropriate parenting. The purpose for these principles is we want to reduce problems, whether it's behavioral or emotional. We want to reduce the amount of risk for child maltreatment, accidental, of course, and we want to reduce the developmental trajectory of problems that are going to set the child up later for other types of concerns. When we talk about ACEs, or adverse childhood experiences, through that have an impact later on, inadvertently through our parenting, we want to make sure that we reduce those. We want to then improve the readiness of our child to be a responsible adult, whether it's through developmental milestones, whether it's social, emotionally, or school functioning. This is a chart that I think is helpful, and that you guys could each have on hand. And it really divides up, we're talking about operationalizing some positive parenting skills. It really takes the foundation of those 5 principles that I reviewed pretty quickly, divides it up into different areas, and provides examples of some skills that could be utilized. These skills are the skills that we're going to talk about at the end, in just a couple minutes, when we talk about a positive and productive parent coaching group that we provide through Hackensack Meridian Health Network. So if we want to get into specific techniques, we're integrating some of these that we talk about. But I do want to talk about, for instance, some of them, just an example. Obviously using behavior chart, using something in teaching new skills and behaviors, something called ask, say, or do, when we're providing a child an example for that. So if they were playing with their Play-Doh and it's time to clean up, we're going to ask. So Sally, Johnny, we need to start putting the Play-Doh away. Do you want to put it in that bag, or you want to put it in a jar, whatever it may be that you've already identified? You're going to say, okay, this is what our choice we're going to do. And then you assist them in doing it. And it's providing structure. So it's not just that one time. Is each time that you're going to do that, you want to use that same ask, say, do technique, so that the child gets used to doing that internally for themselves as well. And that's a really key part of parenting, is modeling, so that the child can start engaging in the same way and making decisions that that we do, so that they can learn for themselves. This is really important. The what about us? This is a foundation part of positive parenting. We want to be emotionally aware of ourselves. How is struggling with parenting impacting us? And we need to give a place for those feelings. It is okay to be frustrated. It is okay to be sad. It is okay to be disappointed. And it's okay to be proud. All of our relationships, our emotions have a relationship with each other in a very difficult time of parenting. So when we're angry, when we're frustrated, we want to say, this is normal. This emotion has a place for itself, and then identify how we regulate those emotions. And we have to practice those in advance. Some people, it's deep breathing. Some people, it's bringing in a feeling from a meditation. Whatever it may be, we have to practice before we engage in the parenting, because it's virtually impossible once we get into the parenting difficulty to just think of what we're doing. We want it to be muscle memory, like actors or performers or athletes do. Is they practice in advance, so then when they get into the situation, they are able to respond as best as possible. Not always going to happen. We want to then model that for our children. How do we regulate emotion? We want to validate where they're feeling. Same thing with ourselves. We're allowing a place for our feelings. We're validating our feelings. And then, of course, being prepared is that concept that I was talking about of practicing in advance, so that when the proverbial stuff hits the fan, whether it's in the checkout counter or it's, at a birthday party or wherever it may be, we're able to respond as best as we can. Really great resource. Catherine Kersey is a clinician at Old Dominion University. She developed top 10 principles of discipline that I think are really helpful. It's now expanded. I think there's up to 97 different principles of discipline, but these are the foundation ones. Demonstrate respect principle is teach children or treat children, how you would like to be treated. Make a big deal principle. Some of these are easy to understand, and we do. It's just a matter of keeping them in the back of our heads and utilizing them on a consistent basis. So we want to make a big deal about responsible, considerate, and appropriate behaviors. And a big deal doesn't mean having to buy a child a gift or do that. We actually don't want to do that. We want to make a big deal through recognizing it, whether it's even just a smile across the room that tells the child that was a good choice. It was a good decision. We want to look at incompatible alternative principles. So we want to look at when a child starts acting out. So we'll use the example of if they're tantruming in the checkout aisle at the supermarket and they're pulling everything off the shelves, we want to give them responsibilities to do. So we're going to ask the child, okay, we're not going to do that. And here's something else. I want you to help put 3 objects on the belt, and then you could earn something for that. Or I want you to help mom or dad pick this out, whatever it may be. So so they can't engage in that problematic behavior. It's giving them something physically to do. The two choice principle. We're going to give them 2 choices, both which are positive and acceptable. This is choice 1, choice 2. What do you choose? It allows them to make a decision. When then abuse it or lose it, that's the typical providing they have to basically earn something. You have to complete your homework. Then you could watch television. If no homework, no television. So they understand consequences. And then we have to be consistent with that, which is very difficult, especially with all the technology that's out there, because they have phones, iPads, televisions, and all the others. So when you make up a boundary, we have to make sure it's something we could be consistent with. Connect before we correct. So that's where we tell the child, listen, I understand that you wanted to do X, Y, and Z, and it may come from this feeling. Tell me a little bit about that, and then correct the behavior. So, Sally, it's not okay that we hit someone. I understand that you're angry and mad. What was going on there? So you're exploring where the behavior came from, and then you could more aptly correct that, but you're also demonstrating how to react to the emotional impact of the child's behavior. Validating is principle. We want to acknowledge the child's wants and feels. So we say that if they're trying to pull things off the counters, so I know that you want this right now, but there are time and a place for it. We set expectations. You can earn it for X, Y, and Z, whatever you choose, but we have to acknowledge their wants and their feelings. I know it's upsetting and so forth. And this isn't just a one-time thing. It's ongoing, and you're moving forward with that. Good head on your shoulders principles is allowing children to, or particularly this is preteens and adolescents, to trust their judgment and make decisions. So you're expressing your support for them as long as it's safe and appropriate. Obviously, you step in if it's not going to be safe. It could be dangerous. Belonging and significance principles helps the child feel important by being responsible. And the timer says it's time principles. It's really important to set timers to make children understand transition. So we have 3 minutes for this, and then after that, we're going to do that. So And then every 2 minutes or so, okay, here's what it's, you've got another minute. Brings up, by the way, setting the timer for timeout. I know that came up in a couple questions. Timeout is a really difficult parenting tool to use. The research shows it is only effective if you're able to utilize it exactly what it was meant for, and that is timeout from all stimulation. So, for example, one of the questions was about using timeout in a daycare setting. I don't recommend that. It is a really difficult thing to do, to create an ideal timeout setting in a daycare without causing the child to feel ostracized and punished. And that's not what timeout is supposed to be. Timeout is supposed to be where you take the child away from any kind of stimuli for X amount. So if they're 3 years old, they recommend obviously 3 minutes. So they're able to calm themselves down. You're able to process with them what's going on. They collect themselves and you move on from it. That's really not you're not able to do that if there's other kids around, if there's another environment around, timeout can be effective, but it's really difficult to employ it in the way that it can be effective. I want to talk, before we wrap up and get to some questions, the No Hit Zone. No Hit Zone is a program of both community education about the negative impact of physical discipline and physical aggression, or physically responding to our emotions. But and it's a national program. Here at Hackensack, we've transitioned that. There's a team up in the north. It includes myself, Dr. DeBellis, who's our division director at the Children's House, Beth O'Keefe, who's our coordinator of this program up in the north, Steve Carries, who's a physician down at Jersey Shore, as well as Juliana David, who's our coordinator in the south. Phenomenal team, put incredible effort into providing a program that's really beneficial to families, with the idea of supporting safe, healthy, and nurturing relationships in families and the community. Focus on preventing and supporting interventions when we see early signs of distress, and promoting that nonviolent conflict resolution within parenting, so children learn about healthy relationships and not responding physically to their own feelings, because that's truly, when we use physical discipline, it's truthfully a physical response to our emotions at the time in parenting. We've provided there's signage and information that goes up into public, but for our purposes this evening, we created a positive and productive parenting group that consists of 6 sessions. They're both in person, like I said earlier, as well as online, and they integrate the principles of positive parenting, which we've been talking about, as well as understanding some developmental trajectory of a child, as well as integrating that into our self-regulation and recognizing we and all of what we bring to parenting is the key to successfully parenting, and because it's about our emotional regulation, understanding, and so forth. So these are the breakdown of the sessions. It's an introduction. The sessions typically are 8 to 10. We limit it to 8 to 10 parents. They stick together, and you'll see through the 6 sessions that parents really form relationships, and that's the community aspect that we talk about in positive parenting. And we hope to create enough of a community environment where parents, caregivers in these groups can rely on each other after the 6 sessions and rely on us as coaches. We talk about these parent groups as coaching sessions because the coaches are there not as therapists or somebody there to correct your behavior, your child's behavior, but they're there as a coach because we think of the coach as part of the team and as part of the interaction in supporting health and growth. So that's why we call these positive, productive parenting coaching groups. The first session is an introduction. We go over the goals and the nitty gritty, all that stuff. Our second section, we talk about education about child development. We talk about the impact of physical discipline. We go over some boundary concepts. Session 3, we talk about that self-regulation. We talk about the emotional impact, how we're feeling. And by the way, most of this is integrated throughout all the sessions of how we're impacted by parenting, some of the stressors, how do we control that, whether it's deep breathing, whatever, some of the techniques that are talked about. And then we really get into the positive parenting from positivity and promoting resilience and self-esteem. And we get into the techniques, the specific techniques that we saw in that chart that I presented earlier. We start to use those techniques in session 5 to responding to different misbehaviors. And then in session 6, we break up into little groups and we talk about managing specific behaviors. So some of them may be, trying to get our child to go to sleep, conflict between peers, acting out in at the supermarket, those type of environments. And we really work through those in a supportive, validating experience. So all parents, I will say, is one of our clinicians, one of our coaches who've participated has told us that in each one of the sessions, parents see there's some parent who really feels the emotional impact and the validation and the reward of these groups and is tearful or crying in a healthy, validating way. So that's what these groups are about, is really providing a support group in a community level, supporting each other, emotionally self-regulating and validating how difficult parenting is, and then coming up with specific strategies to manage our these coaching groups. There is this QR code that you could take a picture of. And of course, you could always reach out to us online to register. Like I said, there's in-person and there's online groups. Love the in-person groups because those are both in Hackensack, as well as down near Jersey Shore, near Neptune, Asbury Park, and so forth. So if you could get to those are great as well. And we open it up to some questions. I know we are limited on time, but if there's some questions, obviously we can't get to all of them, but if you want, certainly reach out to me at my email, which is provided. And I'm more than happy to respond to the email, as well as if we want, we could talk over phone at some point as well. But I'm happy to take a couple questions if you would like to at this point. I'm going to stop sharing my screen so we can make this look easier.
All right. Thank you so much, Dr. Biller. That was very informative. So we'll keep an eye on the time, but we will just do a few questions. So the first one, how do you not come across as a parent figure, but someone who wants to listen?
Yeah, I love that question, by the way. It's a difficult response because we have to do both. We have to come off as a parent figure that wants to hear and relate with our child. So, we can't really split those two. And it's important that the child starts to understand that as a parent figure, that it has to provide love and caring and concern. We also have to provide boundaries and discipline, and those things can coexist together. So it's really important to explain that to a child. It's really important to say is, I love you, I care for you, and I want to hear what you think. I want to listen to. And it's not often what we say, but it's what we do. It's taking the time to sit and really reflect on what the child is saying, which is most important, because communication is really about what we say, how that other person hears it, how they respond, and how we take that in. So we have to remember all aspects of that communication, and that really will help solidify both being that supportive individual as well as that parent, that caregiver, that parent.
All right. Thank you. My son gets the big feelings and has led to him hitting. I think it's out of frustration and him not being able to regulate himself. Do you have any advice for diffusing this, but allowing him to feel his emotion at the same time, but without spiral into him yelling?
Yeah. Again, these are phenomenal questions. I like the word in there that with that question is allowing the child to have their feeling. So there's the first step is allowing them a place for their feelings, and expressing is, I hear you're frustrated, I hear you're angry, but also asking them to express, what are you feeling right now, and help them separate, like we were talking about before, what is going on. Is it anger? Is it sadness? Is it disappointment? And then attack those emotions there rather than trying to just battle the anger that drives the physical response. And then we also have to set the limits too, is we're allowed to be angry, we're allowed to be sad, we're allowed to be frustrated, and we're not allowed to use our hands to, we could talk about it, we could express it. And this is how it impacts me as the caregiver. It really makes you sad, me sad, to see you're sad. And I'm going to talk to you about it. So you're using that modeling. It's not going to work every single time, particularly the first time. It's a matter of getting the repetition and the pattern of your child understanding that this is the way we're going to respond to it. And that's the way we're expecting them to respond as well.
All right, thank you. Another question that had come in, do you see children who might have behavioral problems?
Yes. Yep. Yeah. So if we can't see them, we certainly have the resources that we can make recommendations of who can. I will tell you that, at the Children's House, um, most of our referrals come in through Child Protective Services, law enforcement, but we can provide you resources through our No Hit Zone program on what specifically is best for you and the child you're caring for.
All right. Next question. How do you reason with a 3-year-old toddler who absolutely will not listen to reason, nor understands a stern voice, nor setting boundaries? Nothing seems to work, just shouts and yells, demands.
Yeah. So the first thing I'm going to say is, which is frustrating to us, we have to give a place. It was frustrating to some parents, is we have to give a place for all the feelings that are related to that difficulty we have relating to that 3-year-old. And that is recognizing it is very appropriate. They say it's terrible twos, not true. It is really terrible twos into threes, and where it blossoms into the 3-year-olds, because the 3-year-old, we have to recognize, is at a place where they don't truly know how to communicate what they're feeling. They're struggling to really understand that interactive relationship with the caregiver. So there is no, the word I think was used in their reason. I think the word is, there is no reasoning ability with a 3-year-old. So we have to give that a place and recognize, okay, typically it is going to be very hard to reason with the child. So it's going to really have to be understanding the emotional foundation behind that lack of reasoning, as well as dealing with our own emotions and frustrations that are involved in this very difficult period of time of yelling, screaming, kicking, and being defiant, and trying to model for the child in responding to them and how we want to respond to them to respond to us, and building a support network around yourself so that there are other people that the child may respond to in that moment, because it feels like they never respond to us. More likely than not, there are sometimes that they do respond to us, and that too is something that we need to reinforce. And they may not recognize, they pick up on when they've done something that we don't like. We also have to reinforce of how that makes us feel when they do respond in a positive way, and really overemphasize that. So it's really about understanding our feelings for it, validating that, understanding the child's feelings, giving a place for both of those, mirroring to the child how we want them to respond, even though they may not respond in that moment that way, and building a support around you so that other folks can help out in different situations.
Thank you, Dr. Biller. Do you have any special info on toddlers with autism?
Yeah, so there are websites for toddlers with autism, and there is actually a really strong autism support parent support group in New Jersey. The name of that website, unfortunately, is slipping me, but if you Google New Jersey Autism Parent Support Group, it's one of the first that pops up. And they have a whole ton of resources. I also know within the network, Carrier Clinic is probably a good place to reach out as well for resources that could help out with those areas as well.
All right, thank you. And this will probably be the last question. Um, how do you help an anxious teen? How to calm a child down? Any tools or resources you suggest?
Yeah, the best one is the one thing is it's difficult to start in adolescence, but it's it it like we said, it's the second infancy. So what we want to really do is understand where the anxiety is coming from. Like I said, allow it to have its place, um, and a lot of times the anxiety for teenagers is exacerbated by their fear of what other folks or other peers are going to feel of them if they express their anxiety. So we want to model for them that anxiety is an okay thing. Is we're not going to be able to necessarily get rid of the feeling. It's the idea of how do we manage that feeling. So we have to find out what works for that adolescent. One of the good things for anxiety is physical motion is good, whether it's walking. It doesn't have to be a sport. Some typical mindfulness is helpful, but the real first step, I think, for adolescents is having a place of acceptance for it and saying it's okay. Anxiety is a feeling. There are no real bad feelings. It happens. It's part of it. So how do we deal with it in you? And where is that anxiety? What's the relational feeling? Where is that coming from? Is it disappointment? Is it fear? Is it there's some other feeling that's associated with that anxiety, and trying to learn where that's coming from so you could address the other feeling that's associated with the anxiety, and as well as the techniques of whether it's physical exercise, whether it's listening to music, writing music, whether it's talking to somebody. Those are some really good techniques to utilize in adolescence.
All right, thank you so much. One more that just came in. Are you familiar with any ADHD support groups?
Um, I'm not, unfortunately, I'm not. There's so ADHD is so prolific now, but I say is what you can do is reach out to folks. I think Carrier Clinic is a good resource. There's different resources in different parts of the state, but I know the website, the HMHN website, does have different resources for ADHD, autism spectrum as well. That could be a good jumping off point. So I apologize, I don't have anything specific, but there are some of the websites are really great for that.
All right. So thank you so much, Dr. Biller. This was very informative and helpful. And I thank you all for joining us for tonight's program. Please watch your email for an evaluation of the webinar. Please take your time to fill it out. We want to hear from you. And also let us know if there are other programs that you're interested in, other topics. The link of the recording will be included as well if you'd like to listen to it again. Our next webinar is on motherhood, mind and body on May 30th. And there'll be additional ones that'll be planned throughout the remainder of the year. You can always check our website at hackensackmeridianhealth.org/events or call 1-800-560-9990 to register and find out more about these upcoming events and others. So again, I thank you very much, Dr. Biller. Thank you all for joining us, and I hope that you guys enjoy the rest of your evening.